I merged my practice in with St. Louis Cosmetic Surgery about 14 years ago. I was in solo practice, and at one point we were doing a series of lectures, and it was always Dr. White, Dr. Huffaker, and Dr. Lund being the lecturers. And one day Bill Huffaker, my partner, walked off the stage and he looked at me and he said, "Why don't we just merge practices together?" And it sort of started a little kernel of thought, and next thing you know, a year later, we were merged. I went into plastic surgery because I have this strange kind of background. I am a drama major, sociology major, and a biology person also. So I had a mixture of science and art, and I was looking for something in medicine that kind of combined that, and plastic surgery really was the area that did that. And so after doing cosmetic surgery for a period of time, I realized that that really is the ultimate form of combination of science and art and medicine, and I loved it. And that's why I'm doing what I do. I like doing a variety of things. I know that some of my colleagues love doing just one area of cosmetic surgery, but I like doing everything because I find it fascinating to be able to change different parts, different places, and get the happy result for the patient, not just from doing, let's say, face surgery or breast surgery, but trying to just look at them as a whole person and see what's going to work best for them. Board certification is sort of under intense scrutiny. Board certification means that these surgeons, these doctors, have gone through extra training and then have completed a series of testing that then proves their competence in that field. It's not a perfect system, but it's the best system we have right now to make sure that the doctor that you are seeing has met the standards, training, and qualification in order to be practicing in that specialty. When I first meet the patient, I usually like to ask them about them. I look down and what job do they do? Are they a mom or a dad, and how many kids they have? I like to get to know them first before I even ask them what they're there for. And that gives me a lot of information about where they're coming from. It gives me a chance to get to know the person. And then at that point we focus down on what they're interested in doing. And then I spend a lot of time trying to determine what they're wanting to achieve. What are they hoping for? And then at that point we go into the specifics about the procedure. If it's using something like implants, we talk about the devices. And then at that point we finally do the exam. And so it's a fairly slow process at the beginning, but it's important because you have to establish that relationship with the patient and know what they're coming from, their base is, in order to get the result ultimately they're looking for.